Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning. We'll be speaking with Dr. Richard Lee, Cherng Family Director's Chair, Center for Integrative Oncology at City of Hope. He's joining us to discuss his oral presentation at the Society for Integrative Oncology International Conference titled Reasons and Types of Medical Cannabis Use by Patients with Cancer Receiving Treatment at a Comprehensive Cancer Center. Welcome to Health Professional Radio. Dr. Lee, thank you so much for joining us this evening.
Thank you, Neil. I really appreciate the opportunity to be part of your show here today.
All right. Well, briefly tell us a bit about yourself, and then let's talk about this presentation.
Yes, so as you mentioned, I'm here at City of Hope, one of the largest research and treatment organizations here in the United States. I'm currently a clinical professor, and I'm a GI medical oncologist as well as practice palliative care. And my main role here is to focus on integrative oncology at City of Hope, and we're establishing a new center called the Cherng Family Center for Integrative Oncology. Recently, I was able to present some of my research looking at the use of medical cannabis. We conducted a study looking at patients' use of medical cannabis during active treatment. And during the study, we collected over 300 responses. And what we found was that many patients are, in fact, using medical cannabis. In fact, almost a quarter have been using medical cannabis in the last 30 days. And the reasons for this use varied. Many patients were taking medical cannabis to help with symptoms such as insomnia, pain, mood, and to help with their appetite. In addition, we found that they were using a variety of different forms of cannabis, ranging from gummies, about a third, to smoking, liquid forms, edibles, and pills. And 80% or more felt like the cannabis did work for their symptoms, and very few actually reported having any negative side effects from the use of medical cannabis during treatment. When we asked about if they had discussed this use of medical cannabis with their medical teams, almost two-thirds had not, and the most common reason was nobody ever asked about the cannabis use. So it was a really interesting study and gives us more information about what patients are doing with medical cannabis during cancer treatment.
CBD and THC. Explain the differences between the two, and are they both effective in treating patients, or are some patients more likely to benefit from one over the other?
Mm-hmm. It's a very common question. So CBD, or cannabidiol, and THC, tetrahydrocannabinol, are the two most common ingredients found in medical cannabis. And there's research to show that the combination together can be helpful for pain. In addition, THC by itself is actually FDA approved to help with treatments around chemotherapy-induced nausea, as well as to improve appetite. Versus CBD has a lot less research, although there's growing data that CBD might be helpful for sleep and may also help with muscle spasms. And is also FDA approved for specific types of pediatric seizures. And so that's another reason individuals might be using CBD. But we really need more research regarding both compounds and what it might be most helpful for, and understand the risks and benefits for patients.
Was it more effective for patients for the side effects of their treatment, or for the aches and pains in general?
So our research specifically focused on patients receiving chemotherapy or some kind of treatment, chemotherapy, surgery, or radiation, and we have a variety of patients. And so most of the patients seem to be using it for different types of symptoms, not specifically just aches and pains, although pain was one of the most common reasons, but other reasons included insomnia or neuropathy, loss of appetite, and as well as mood, such as stress or anxiety. I don't think we have enough data to know for sure which compound, whether CBD or THC or the combination, might be the best for each of these different symptoms.
Peripheral neuropathy that's chemotherapy-induced, it's my understanding that this is a common side effect of chemotherapy. Talk about how CBD and or THC can effectively alleviate some of these side effects.
So, correct. Chemotherapy-induced peripheral neuropathy is one of the most common neurological side effects due to certain types of chemotherapy, oftentimes platinum-based or what we call taxane-based chemotherapy. There is growing information, although still preliminary, that medical cannabis might be helpful for the treatment of chronic chemotherapy-induced peripheral neuropathy or nerve damage that occurs through certain types of chemotherapy. I actually have a National Cancer Institute research grant to study whether or not CBD versus CBD plus THC might be helpful versus a placebo. And we're about to begin that study in the coming months. And so that's what our research is really investigating, because there isn't enough high-quality data to know for sure if it's really helpful or not.
You mentioned integrative medicine early in our conversation. Could you talk about the Cherng family and the gift that they've given in order for you to advance your research?
Yes, I'm happy to discuss about the very generous gift from the Andrew and Peggy Cherng to help develop first of its kind National Integrative Oncology program. And the center is going to be called the Cherng Family Center for Integrative Oncology. And our goal is to bring the best of Eastern and Western medicine to improve outcomes and quality of life for cancer patients and survivors. There's really going to be three major pillars regarding the center. One is delivery of clinical services such as acupuncture, meditation, oncology, massage. Two, will be conducting research and really bring scientific rigor so that we can understand the benefits of these types of therapies with the hope of establishing them as part of standard of care. We really want to interweave these therapies as part of the very comprehensive and holistic care that we provide at City of Hope. And the last pillar is really around education. We want to be developing the next generation of integrative oncologists so that others can receive these types of therapies at centers around the country.
Will combining Eastern and Western medicine include research into cannabis, medical cannabis as well?
Yes, in fact, traditional Chinese medicine includes a variety of different plant-based compounds and herbs and approaches as part of their herbal formula. And it has been found that in traditional Chinese medicine there was medical cannabis as part of that spectrum of natural plant products that they utilize. And so we're very interested in looking at natural plant products and extracts to understand how they, one, might help with symptoms and quality of life. But we also plan to investigate these plant extracts to look at their anti-cancer properties in hopes of identifying new drugs that we can develop into new anti-cancer therapies, which is one of our really hallmarks here at City of Hope. We've really been innovative in terms of treatments, not only with stem cell transplant and more recently immunotherapy and CAR-T. We think integrative oncology is going to be another great resource for us to develop new therapies and strategies to help cure patients as well as help alleviate their symptoms and improve their quality of life.
Give us a website where listeners can learn more.
Yes, listeners can learn more at www.cityofhope.org, and they'll be able to learn more about City of Hope as well as specifically the new Cherng Family Center for Integrative Oncology, which is going to be a groundbreaking center to help improve the standard of care for all patients.
Richard, I appreciate your time. Thank you so much for joining us here on Health Professional Radio.
Thank you so much, Neil. It was my pleasure to be here.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Richard Lee. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.